Hello, everybody. Welcome, and thanks for joining us today. Welcome to the first of 3 30-minute sessions that are part of the Steady and Raise Leadership Series. We'll get started with a little bit about me. I started Interactive Quality about 10 years ago. My name is Beth Guyton. I have always had a heart for the frontline caregiver and am very passionate about developing leaders and cultures that enable employees to bring their absolute best to work, to their teams, and to their patients. And that in turn, leaders and cultures can enable staff to take away a strong sense of accomplishment, fulfillment, and even joy from their workday. I am so excited to be working with Audrey Cortez, who is an experienced nurse leader. She developed the Steady and Raise model that I'm going to share with you today. Time is precious, so let's get started here. Steady and Raise is an evidence-based resiliency model that was developed by Audrey Cortez. Its genius is that it takes an incredibly complex topic, building resiliency, and puts it into an easy to operationalize model. This model is proven and has been implemented with hospitals seeing enhanced patient satisfaction, decreased turnover, and enhanced engagement among their staff. Our intention for this webinar series is to share the model with you and give you some concrete steps and practical tools you can put to work to build resiliency in your organization. In 3 30-minute sessions, we will not be able to share the entire model and train you as if we were implementing it in your hospital, but we will be able to give you a helpful taste of it and some actionable insight. So let's get started. Let's just kind of center our thinking around COVID and the cost of COVID. The most obvious cost of COVID-19 has been the loss of human life. So far, we've seen over 83,000 COVID deaths and almost 1.4 million Americans have tested positive. There's also been a financial loss. It's in anticipation of COVID, we all saw the stock market plummet, and to date, 33 million Americans have lost their job. Some estimates claim that only 51.4% of Americans that could be gainfully employed right now are actually employed as we look at the April numbers and move into May. Immediate concerns with COVID were the cost in terms of human life and our nation's capacity to care for those who would contract the virus. Would we have enough hospital beds? As the pandemic progressed, PPE and ventilator shortages surfaced as serious issues. Then social distancing created unprecedented job loss. As the pandemic continues to unfold, we see rural hospitals closing, unions suing hospitals for not providing appropriate protective gear, and a greater number of uninsured individuals in our communities. Some of the costs of COVID are more obvious than others, and as we move forward, we will undoubtedly better understand the far-reaching impact of this pandemic. Let's take a look at how COVID has impacted the average American. As I mentioned, over 33 million Americans have lost their jobs. For many, COVID has robbed them of their livelihood and their way of life, creating unanticipated and really unimaginable stress. Sheltering in place causes both emotional and logistical difficulties. Those still employed find themselves working from home in makeshift offices and suddenly taking on the role of teacher to school-age children. Grateful to have a job, but struggling to get it all done. Some have fallen ill to COVID or have a family member stricken with coronavirus or even lost a loved one to the disease. Others have had care for non-COVID illnesses, maybe chronic diseases, oncology treatments, or planned surgery interrupted or delayed. These folks are suffering both physically and emotionally as well. I think we all feel a loss of freedom and anxiety over the uncertainty that lies ahead. The struggle may be different for each of us, but most Americans are experiencing significant loss and hardship during this time. Much of what we take for granted has literally been taken away. Social distancing and sheltering in place diminish the human connection we take for granted, and these social interactions and meaningful connections are a necessary part of our well-being. This forced isolation takes a great toll on our psyche. Think about all the loss and disruption. Young, carefree college students have been kicked out of their dorms and sent home, living the unimaginable. Their new roommates might just be their parents. Celebrations of major life events such as weddings or birthdays and baby showers have been taken to the curb. Even mourning the loss of a loved one in a funeral gathering is not possible. Human connection is central to both physical and mental health, yet this basic resource for resiliency has been diminished, and we find ourselves sitting alone, fearful of our uncertain futures. This loss of freedom, psychological safety, and human connection are significant for everyone. And yet, caregivers carry even heavier burdens. Many are experiencing moral injury as they take care of patients in ways that are suboptimal. Patients are not able to have loved ones at the bedside, and protective gear and physical barriers depersonalize the connection between the caregiver and the patient. While this is hard on patients and family members, it's also very painful for the caregiver who may feel guilt and shame, and in some cases, even betrayal and anger because they perceive that they have let their patients down. Shortages of PPE have caused incredible stress as they worry about their own personal health and the health of their family. Many are reporting a desire to leave the profession. Today's focus is on a solution, the Steady and Raise model, but I do want to take a few slides and a little bit of time just to define burnout and discuss its cost. Burnout is a prolonged response to chronic, emotional, and interpersonal stresses on the job, and it's defined by three dimensions: exhaustion, cynicism with detachment, and inefficacy. It's helpful to know what burnout looks like so we can recognize it in ourselves, our colleagues, our staff members, and that in that way we can help and support one another. So the first and most obvious sign of burnout is just overwhelming exhaustion. And many who suffer from burnout find it very difficult to get the sleep they need in the evenings. And this exhaustion is it's mental as well as physical, and it's a direct result of stress. And it causes individuals to change their behaviors to try to protect themselves and self preserve. And then you begin to see cynicism with detachment. So there's a negative feeling towards work and towards others. And to protect, we kind of build a wall around ourselves and detach and distance ourselves emotionally. And this happens with coworkers, patients, and even our loved ones at home because it spills into our private lives as well from our professional lives. And we begin to see patients as well as coworkers and loved ones as objects. And we don't really appreciate their uniqueness and their engaging qualities, which is kind of a double-edged sword because we need that kind of connection to build up our well-being and our resilience, but yet in an effort to try to protect ourselves from burnout, we cut ourselves off from that resiliency resource. And then the third piece of the puzzle is feeling ineffective. So we may feel like we're working really hard, but it's all pointless. At the end of the day, it just kind of didn't even matter. And in that way, work becomes annoying and frustrating. It's not very fulfilling for us. Many academic studies define burnout as being on the opposite end of the spectrum of engagement. And I think that's important to remember as well, because engagement is described as having energy and vigor for the work that we do. Now, we'll just talk briefly about the cost of burnout. I want to caution that this slide and the next one is data pre-COVID, and it is focused in the cost to hospitals. So again, these are pre-COVID numbers, and the data is specific to hospitals. Prior to the pandemic, it was estimated that the cost of burnout-related turnover in hospitals was $60 billion, and that represents 5% of annual hospital revenues in the United States. The average annual cost of burnout due to lost productivity and mistakes is estimated as 48,000 per physician you have in your facility and 5,000 per nurse in your facility. So the larger your hospital, the more expensive this is for you. The average cost of turnover is estimated at about 800,000 per physician and about 95,000 for each nurse that is turned over because of burnout. And the rate of turnover for clinicians who are burnt out is about 21% for physicians and 20% for nurses. And again, pre-COVID, this is the data we have. About 54% of physicians reported being burnt out. And when we looked at those three attributes or characteristics of burnout, the way this data is analyzed is if a clinician reports one of those, then they are considered burnt out. And 63% of nurses pre-COVID reported that too. Now, this is some data from a study done by Hullabaloo and Feed Trail about 3, maybe 4 weeks ago. And it's primarily with nurses. They had 1,300 respondents that were nurses. And I think what's significant here is in the midst of the pandemic, 3% of the people in the survey said, hey, I've already resigned my position. And 67% reported plans to leave their facility or the healthcare industry altogether. So that's pretty powerful that 70%, and again, mostly nurses, are saying, I'm kind of ready for a change here. And they reported the cost of burnout in the wake of COVID to be 137 billion, so much higher than the pre-COVID numbers. So let's talk a minute about resiliency. It's defined as the ability to rapidly and effectively rebound from a crisis, an event, or a tragedy that causes psychological and behavioral stressors and hardships. It's the positive to the negative of burnout. So resiliency is characterized by optimism and an open learning mindset, having powerful, meaningful connections, human connections, having a purpose, and a strong sense of self-efficacy. For these reasons, building resiliency is an effective strategy to mitigate burnout. This is a focus of our time today. We'll discuss some concrete actions leaders can take post-COVID-19 to build resiliency among their teams. The Steady and Raise model provides the framework for our discussion. The good news is that resiliency can be learned and it can be taught to your staff. Research clearly shows that healthcare organizations can and should take an active role and an organized approach to helping staff deal with stress and to prevent burnout. Steady and Raise is an evidence-based resiliency model that was developed by Audrey Cortez. Audrey is an experienced nurse leader. She's held the CNO position in several hospitals. Currently, she's a patient experience director at a Texas hospital. And of course, moving up through the ranks, she's worked as a frontline nurse, nursing supervisor, and nurse manager. She keenly understands the challenges at the bedside, as well as organizational challenges involved in changing cultures and operationalized strategies and initiatives. So Steady and Raise is really unique in that it provides individuals with strategies and skills to improve their personal resiliency, but it goes beyond the mindset of clinician, here are some tools for you, please go heal yourself. It also offers a framework for leaders and organizations to develop a culture that supports staff in building resiliency. Steady is the portion of the model that applies to everyone's behavior. Raise is the leadership and organizational framework for supporting staff. We're going to focus on Raise during these 3 sessions, but I do want to quickly review the components of Steady in the model. So S is for seeking stories. T is for turning around thoughts. E is for empathizing, and we do really focus on helping people understand how they can empathize, but not fall into sympathizing, which would draw them into hardships and dramas of others. Avoiding judgment is the A. D is don't take it personally. So we really focus on not taking things personally. And U, it's so powerful, what you do matters to build that self-efficacy. So the RAISE part of the model defines a leader's role in building resiliency. It's a guide for helping followers navigate change in a way that is healthy for them. Leaders should be positive, inclusive, extending a voice to all staff, and role modeling behaviors that are reflective of your organization's values. R in the RAISE model is about genuine and trusting relationships with followers. This step cannot be skipped or skimped upon. Having an authentic relationship means knowing what motivates and inspires each individual on your team, and it also means that staff perceive you as a trusted leader who places the best interest of patients, staff members, and the organization above your own. Without a meaningful connection, the trust and credibility necessary to help team members navigate change cannot exist. A powerful evidence-based leadership practice for building trust and commitment is to actively connect daily work and things like the praise you give staff, the request you make of your staff, explaining why, explaining tough decisions that you may make or that may be handed down to you from senior leaders and you're sharing with your staff, to frame all these things in the context of your organization's values and mission. By anchoring interactions and values, you help staff make sense of what is unfolding. You illuminate the meaning and the purpose in the struggle through these shared values and united mission and your genuine caring relationship with your staff members. Having a strong sense of purpose and meaning are an essential part of building resiliency. A is for acknowledge. As a leader, it's important to remember that all followers have different temperaments. Strive to meet each team member where they are. Don't judge their perspective. Don't compare one staff member's reaction to another's response. Respect each person's story and choose to relate to them as they are. This will require you to be aware of your personal biases and your own perspectives. One of the tools that you'll receive today is a leader's self-reflection guide. We build resiliency as we navigate through our challenges. And a very important piece of building resiliency is a moment of submission, a pause to absorb the event and acknowledge the hardship it's causing. You'll be better able to acknowledge your staff's stressors and struggles if you take a little time to reflect on your own response to this pandemic. Acknowledging the struggles and the hardship is a very important piece of absorbing the incident and ultimately rebounding from it. If we deny or gloss over the difficulty, we don't gain the valuable learning that comes from life's challenges. And this learning really is the seed of resiliency. So I encourage you to allow yourself a moment to reflect and acknowledge the loss, anger, injury, stress, or pain you might be experiencing as a result of COVID-19. Self-awareness and understanding of your own perspective will enable you to acknowledge your followers' struggles in a way that is non-judgmental and supportive. The next leadership behavior in the RAISE model is I for investigate. As a leader, you don't ever want to dismiss a follower. You want to truly understand their perspective and the causes of their stress. Many common stressors for caregivers center around work processes, staffing, and interpersonal conflict. To investigate means to look beyond what is obvious, beyond what is observable on the surface. If you think about it, private investigators, they start with the same information that's available to all of us, but they look beyond what is obvious to the untrained eye. Be a sleuth. Look for what lies beneath the surface and remember that self-doubt is often a big part of most issues. Investigating, listening, and reinforcing with staff the message that you are enough and what you do matters is very powerful. Be intentional. Take time to listen with a focus on understanding what lies beneath the obvious. Reinforce with your staff that they are enough. Let them know that they really are making a difference. A tool that you're going to receive today is an active listening guide, and this will help you with your investigating. Another good idea is to have a couple of comfortable conversation starters in your back pocket so that you can engage in successful one-on-one investigating. Here are some ideas. It's really ideal to approach the staff initially with a word of appreciation and just social, kind of how are you doing? And you want to use questions that are comfortable to you to get into the investigating and communicate a genuine desire to understand how staff is doing. These are just some ideas for back pocket questions. What would you say is your biggest stressor right now? What's the most important thing for me to know or understand? And what is the one thing I can do for you right now? Because COVID has been such a disruptive event and really is changing the way we do everything going forward, it makes sense to hold structured listening sessions so that your organization can have a unified strategy, kind of an organizational approach for investigating and building resiliency. A formal organized session to acknowledge and investigate creates an organizational approach to building resiliency among staff. A facilitated sharing and listening session enables the organization to gather valuable information regarding what is needed to foster trust and support caregivers as we move forward. Gathering this information allows you to evaluate resources, to strategize, and to commit to a plan to build resiliency and decrease burnout in your organization. For now, let's consider the key elements of a successful sharing session. You will definitely want to establish a well-defined agenda that's anchored in your organization's values and mission. It's important to train facilitators that will be conducting the sessions so that you can ensure that every single attendee has the same positive and consistent experience. Sessions should focus on praise, gratitude, and most importantly, listening. Define a reliable process that you will use during these sessions to gather information. Strive to collect data on 3 levels. Ask specifically what is needed on the organizational level, what support is needed from immediate supervisors, and also how can peers support one another going forward. The S in RAISE is for support. A leader's job is to support and to coach. As a leader, you set the tone. You coach and build others. When supporting, you're careful not to take on others' problems. You fix what you need to fix and what you can fix. Supporting and coaching involve listening, understanding, and being aware of problems and concerns. To effectively support and coach, a leader models calm, is respectful, recognizes, rewards, and celebrates others. A leader is always fair and consistent in how they treat others, no favoritism. Having developed genuine relationships, you can draw on those personal connections and the ongoing investigating you do to listen and understand your staff's needs and concerns. Strive to make the support you offer personal, addressing the needs of each team member. In our next webinar, we'll see how we can utilize a structured, facilitated sharing session to create an organizational approach to investigating what support is needed to build resiliency. We'll discuss specifics around support in that context with the goal of identifying a strategy to deliver support that's both meaningful to staff members and feasible for your organization. So we'll focus on trying to really put together a game plan for you to hold these types of sessions in your organization. And now E for evolve. This is the final leadership behavior in the RAISE model. I think we can all acknowledge that the biggest challenge for a leader is to get staff to accept change, to get everyone on board together in a timely manner. Some key aspects of helping your team evolve are to explain the why in a meaningful and relevant way and to connect it back to shared values and your organization's mission. To help staff see that change is normal, it's a part of our routine existence, and that it can really be good for us. To respectfully challenge ourselves and our teams in regard to how we view change. Remember, self-awareness is a powerful leadership tool. Take time to reflect on how you view change and how you respond to change. Consider what you are role modeling in your response to change. What resiliency practices are you modeling for your staff? If a leader is negative towards challenges and change, then that will be reflected in their team's behaviors and attitudes. Staff will mirror what you reflect to them over time. The only place we grow is outside of our comfort zone. We learn through our struggles. Challenges like those thrust on us by COVID-19 present great opportunities to change our thinking and behaving, to innovate and to grow. As a leader, it's important to role model responding to these types of challenges with an optimistic growth mindset, modeling the ability to evolve. When we're resilient, we're able to interact with our environment and its stressors in an optimistic and adaptive way, with a focus on purpose, human connection, and personal growth. Resiliency can be learned, taught to your staff, and woven into your organization's culture. Research clearly shows healthcare organizations can and should take an active and organized approach to helping staff deal with stress and prevent burnout. There's no better time than now, post-COVID, to begin building resiliency of your caregivers in your organization. Thank you guys so much for tuning in. We're gonna take a moment to collect questions and see if we have any questions. You can use the Q&A feature if you'd like to ask a question. All right. Somebody was asking that with with COVID and kind of the new normal, um, do we provide training in a virtual format for this type of program? And the answer is yes, of course. We are doing that going forward and always willing to work with an organization to meet their specific needs. Um, Somebody else asked, would this model work outside of healthcare? And absolutely, the whole model is evidence-based. It was developed specifically for the healthcare setting, understanding the extreme pressures that healthcare workers go through, but definitely the model and the structure would apply outside of healthcare. All right, and then someone else asked, how does staff typically respond to this? And I think what's so important and so wonderful about this is it definitely is seen as a resource by staff. And staff also, you know, I think the key is to create embedded in your organization's culture so that we can have common understanding and almost language, cultural language around different terms and help each other when we're kind of feeling down and able to support one another to build resiliency. Like a good example is the Q-tip term, which stands for quit taking it personally. And I know in one of the organizations where Audrey Cortez has implemented this, that is a very common saying and part of their culture is when people are kind of feeling down, say, hey, remember Q-tip. So don't, you know, don't take that personally. And then they can support one another in that way. Okay, and and someone else is making a comment that it sounds like this is a really great program post-COVID or not. And I would agree with that because pre-COVID, burnout really was the single biggest problem I would say facing healthcare organizations, particularly hospitals, kind of keeping them from being able to achieve their strategic objectives. So I just want to thank everybody for tuning in. I want to remind y'all that next week we will do another quick 30-minute session. Another 30-minute session on Wednesday the 20th at the same time, 12:30, and we'll be talking about how you can set up this listening session if that's something that you think your organization may be interested in doing, and we'll give you a lot of tools so that you can move forward and make that happen. And then the third and final session that we will do is going to be a real treat because Audrey Cortez will join me. She is one of the best storytellers I have ever met. And so we'll be giving you some tools on how to create a strategic narrative and deliver it. So you'll get a little handout on that, and we'll hear Audrey tell a couple of stories and kind of go back and evaluate the stories and see why they were so powerful. So again, thank you all so much for joining us today, and I look forward to you tuning in next week. Take care.